The week-long visit of the Director General of World Health Organization, Dr. Tedros Adhanom, to Nigeria, among other issues, is to host the Global Policy Group meeting in Nigeria, interact with development partners so as to come up with new planning and budgeting process for Africa. The DG, who visited the Northeast to ascertain the country's preparedness to respond to outbreak, also visited several health institutions in Nigeria, including the National Center for Disease Control, NCDC. While briefing journalists on his level of satisfaction, he drums the need for investment in health as well as the need for Nigeria to take universal health coverage seriously.
It tries to show why investment in health actually is important, and not only the lives that we can save by investing in health, but at the same time saving also resources. Moving forward is very, very important. But in Nigeria, the other thing we have witnessed is not just the universal health coverage in general, but focusing on its foundation too. And as you know, the foundation of the universal health coverage is primary health care. And that's why you have the revitalization of primary health care together. Leadership of the government is important, the commitment of the government is important, but at the end of the day, it wouldn't be fruitful without ownership of the citizens of Nigeria.
On tackling outbreak, he stressed the need for Nigeria to prioritize prevention for any kind of disease. He maintained WHO's resolve to immunize 1 billion people in Africa against yellow fever.
Consolidated fund is very important. So I think Nigeria needs to speed that up, because it's with resources that you can implement the very ambitious. For outbreaks, I think we should start from prevention. And then we have to strengthen our surveillance. That's why we have the Emergency Operations Center. And then detect early and respond swiftly. So we're happy to witness that.
On his part, the Minister of Health, Professor Isaac Adewale, reiterated his call for the establishment of regional laboratory for yellow fever screening in Nigeria.
States must continue to prioritize health, and states must continue to implement a health agenda that is really supportive of the federal agenda. And that's what the NCDC is doing. We are beginning to be able to pick outbreaks much faster. We have surveillance officers all over the country, and so whenever there is an outbreak, we pick them quickly. We've also enhanced their capability to make diagnosis. We made a plea on Tuesday. We want a regional laboratory for yellow fever, so that we don't have to take our samples to Senegal. And we want you to please, I'm saying please, support us to have a regional laboratory for yellow fever.
Professor Adewale assures of government effort at involving all stakeholders in achieving universal health coverage. Joseph Kadri, ITV News, Abuja.